25% of adults over the age of 50 experience chronic knee pain due to degenerative osteoarthritis. Usually when I see patients for this, they'll complain of pain that's worse when they try to stand and walk and relieve with sitting down. It gets worse with cold weather or when the joint is really stiff. Initially, to get a diagnosis, usually you see your doctor. They may do a physical exam to check for signs of osteoarthritis and then order some initial x-rays to confirm that diagnosis. Sometimes, depending on how severe the symptoms are, they may even order an MRI to check for other problems like ligament or tendon tears. Initial conservative treatments include things like physical therapy to strengthen the muscles around the joint to help offload the joint itself. Also, bracing and anti-inflammatories can be helpful if you're a person that can take those. You might be someone who wants to try some conservative treatments like glucosamine or turmeric supplements, which do have some evidence, or even something like acupuncture. If those treatments are not helpful, then you might be a candidate for injections into the joint, which can include steroid, hyaluronidase, which is a gel type injection, or PRP, which is platelet-rich plasma. How you respond to those injections really depends on how severe the osteoarthritis is. If your osteoarthritis is very severe and very painful, then you may be referred to an orthopedic surgeon for consideration of a total knee replacement. As a pain specialist, I see patients all along this continuum. So some of my patients have just started having knee pain and they're just looking for initial conservative treatments, and some of my patients have had knee pain for years and maybe even have already had a total knee replacement and are still having symptoms. For those patients who have already had a total knee replacement and are still having pain, usually we're talking about ongoing medication management, which can include things like chronic anti-inflammatories. Sometimes it can be topical medication. Sometimes it can include chronic opioids. Another option for patients is a peripheral nerve stimulator, which is a tiny wire that targets the genicular nerves, which innervate the joint. This just tries to control the pain signals that the nerve is sending. Ultimately, the goal of all of these treatments is to try to make you more functional so you can do the things that you enjoy.